You wouldn't be able to recognize uterine polyps until you feel few symptoms over the time period. That could be related to irregular cycle or spotting in between your cycle. Besides that, if you have abdominal pain that can be mild to moderate, and you have lower back pain, and you are facing constipation problem, and sometime while passing stool you have seen blood as well, that could relate to uterine polyps or endometriosis. Usually uterine polyps grow in the inner lining of your uterus, that is called endometrium. If you are in your 40s and 50s, you can develop uterine polyps because at that time you are in transition of menopause. You are facing lot of hormonal changes. Apart from that, if you are obese, if you have high diabetes and you have high blood pressure, that can also few reasons to develop uterine polyps. How it can be diagnosed? Usually uterine polyps are diagnosed accidentally because they are asymptomatic, and usually it does not create problem, and pain is not the main cause of the uterine polyps. If you have uterine polyps, it may possible that sometimes those polyps slip through your cervix. So while doing transvaginal scan and pap smear test, they can be seen in ultrasound by your obstetrician. So at that time you will get to know that you have uterine polyps. They are non-cancerous cell growth, so you shouldn't be worried much. There are few treatments available to solve this problem. Usually medication can help to reduce the size of polyps, but once you stop taking medicine, then it comes back again. So this is not the permanent solution. Besides that, endometriosis ablation or hysteroscopy is also a very well-known treatment for uterine polyps, so people usually go with that. If you want to treat uterine polyps naturally, then usually calcium and vitamin D really helps to reduce the size of polyp, but this is not the permanent solution. I hope you like this information, and if you like it, then please take a moment to subscribe my channel.